What does and does not help kids with ADHD improve their impulse control? Let me first explain why kids with ADHD struggle with impulse control. Well, impulse control is a core executive function skill. And as I always say, ADHD is an executive function developmental delay. So a person with ADHD, their executive function skills are developing approximately 2 to 3 years behind their same age peers. So for example, if you have a 10-year-old with ADHD, their executive function skill age is closer to that of a 7 or 8-year-old. So we have to think of their impulse control in this case being that of a 7 or an 8-year-old, not of a 10-year-old. On top of that, in the wide range of profiles we see with ADHD, there can be really severe impulse control challenges, or there could be mild impulse control challenges, or in the case of somebody with an intent of ADHD, there tends to not really be any impulse control issues at all. So keep that in mind as well. So the reason why kids with ADHD struggle with impulse control is a few things. Number one, to have impulse control means we are able to think ahead into the future and think about the potential outcomes of a situation. That requires what's called nonverbal working memory, or what I call future thinking skills. For example, if I know that I'm making coffee in the morning on my percolator, which I suggest everyone gets because percolator coffee is great, one of the things I have to think about is if I touch the pot while it's hot, I'm going to get burned. In order to do that, I have to picture myself, touching the pot and getting burned from it. Well, for somebody with ADHD, they have difficulty with nonverbal working memory or future thinking skills, so they're often not thinking about potential outcomes for something. Additionally, in order to have impulse control, you have to have an internal dialogue in your head saying, if I do this, this might happen. And you have to be able to consider different options. Well, in order to have that internal dialogue in your head, you have to be using your internal dialogue. People with ADHD have inconsistent use of their internal dialogue, or what I refer to as brain voice with kids. So if you have inconsistent use of your internal dialogue, you're not really having that discussion in your head whether you should do something or not. And if you have difficulty with nonverbal working memory, you're not really picturing the potential outcome of something. In addition to all of this, people with ADHD often have difficulty with emotional regulation. They can go from 0 to 100, in terms of anger or being upset very quickly. So in the cases of somebody who has difficulty with emotional regulation, when we combine that with this inconsistent use of internal dialogue and difficulty with nonverbal working memory, it makes sense then why somebody with ADHD might struggle with impulse control. And again, that can even happen without the emotional dysregulation piece. So I want you to keep that in mind. So I want to mention a few things that are not going to help with impulse control. Number one, saying things like think before you act. Well, if kids with ADHD could think before they act, they would, and often they do, but it's inconsistent because ADHD is a condition of inconsistent performance. That's something I got from Dr. Barkley. Dr. Barkley actually calls ADHD intention deficit disorder. You might intend to do something, but it doesn't always happen. So it's really important to keep in mind that people with ADHD might be able to do something 5 out of 10 times one week, and they might be able to do it 3 out of 10 times the next week, and the next week they might be able to do it 10 out of 10 times. So that can be really confusing for parents and also for teachers. One of the comments I've heard a lot is parents or teachers say things like, he knows what to do, he just doesn't do it. It's not that they don't do it, it's that they're not remembering to do it because of this inconsistent performance. Number two, therapy is not going to help develop better impulse control. You don't develop impulse control by sitting in a therapist's office talking about feelings or role playing or talking about, what's the right thing to do. Number three, punishment does not help develop better impulse control. Now, I am not anti-punishment because every culture in the world exists with some type of punishment. And I do believe that rather than punishing kids, because that doesn't change behavior, we have to let kids experience natural consequences when appropriate. And more importantly, we have to teach kids accountability and how to clean things up when they make a mistake. That's a concept I teach in Scaffolding Better Behavior, which is the ADHD Dude Parent Behavior Training Program. So my point being, punishment will not change impulsive behavior. It will not speed up executive function skill development. So what does help with impulse control? In my experience and based on the research data that I've read, it's 2 things. Number one is medication. So medication has evidence of helping with impulse control, and that has certainly been what I've seen for many years of being in this field. Keep in mind, there is no best medication to help with impulse control. There is a medication that works for your child, and there is no way to predict that. There is no test you can do to see which medication works best. It's completely a matter of trial and error, and that can be frustrating for families. but medication is the number one thing that helps most with impulse control. Number two is brain maturity. So the more the individual's executive function skills development, the better they get at impulse control. Now, most people with ADHD, their executive function skills are done developing around age 26. For somebody with ADHD, their executive function skills are not finished developing until around age 28 or 29. So many parents ask me, if their executive function skills aren't done developing until 28 or 29, will they basically resemble somebody without ADHD at that point? And the answer that I learned, again from Dr. Barkley, is wherever your executive function skills are when your brain stops developing, that's where they will stay. So for some people, yeah, it might appear like they don't have any symptoms of ADHD anymore. And for some adults, yes, they continue to have these symptoms of ADHD throughout their lifetime. And that's okay, because those are things that they can learn to manage as adults. And also medication can continue to help them. So really, to help your child with impulsivity, the two things you can do are medication management and brain maturity. There's other things I suggest as well that I do believe can be helpful, such as teaching them delayed gratification. So teaching them to wait for things, making them wait for things. So maybe not the answer you wanted to hear, but I always want to be realistic with people about ADHD and impulse control. So I hope this is helpful. Feel free to leave any questions or comments, and I will speak to you soon. Take care.